Hi, I'm Dr. Jeff Willers. I'm an orthopedic foot and ankle specialist here at Elite Sports Medicine and Orthopedic Center. This is my 15th year at Elite. Today we're going to talk about common foot and ankle issues as well as ways to potentially avoid injuries to the foot and ankle. As a child, I always enjoyed fixing things and solving problems, whether that be puzzles or Rubik's Cubes or complex math word problems. My father was who's now a retired orthopedic surgeon, was constantly engaged in projects around our house and on our farm. And as his helper, I was pulled into helping him and really grew to enjoy using both my mind and hands in fixing things. I treat a very wide range of things from childhood growth-related injuries or pain to athletes and their injuries, whether they're in high school, college, or professional sports, and then also age-related things in older individuals. In terms of what we see with athletes and their injuries, that also is a broad range of things, which includes ankle sprains and ankle instability that sometimes results after sprains, to fractures of the ankle or foot, to Achilles or other tendon ruptures or tears, and then also stress fractures and other overuse type syndrome. Well, you can't really prevent those things because I think we're all like being active and being engaged in both sports and other things that we like to do. But certainly there are some things that you can do to help reduce the incidence or potential of being injured. Those things include stretching before and after activities, making sure that you cross-train and do a wide variety of activities and not just one sport, to being very smart and gradual as you're increasing your training, and also cautious as you transition from one sport or season to another. Younger individuals, some growth plate related injuries, and then in older individuals you see things such as arthritis and degenerative conditions of tendon. Really, the main thing when recovering from a foot and ankle injury or recovering from a foot and ankle surgery is avoiding any impact activities or trying to minimize that impact activity. So doing things such as swimming or biking or elliptical are certainly much easier on the feet than would be running. A bunion really just means a bump over the big toe, and typically what goes along with that is a curvature of the toe. And a hammer toe is when the toe bends and draws up. Really, those things oftentimes can be treated conservatively, and they don't often require surgery, but we try to reserve surgery for conditions when there is pain or difficulty with shoe wear, or when sometimes it leads to the development of other deformities. Well, if you break down osteochondral, that means bone and cartilage. And so what an osteochondral defect is simply a defect or an abnormality of the cartilage and the underlying bone beneath that. That can be caused either by trauma, such as an ankle fracture or an ankle sprain, or it can be idiopathic, which just means, is a fancy word that means we don't know the cause of it. And so sometimes they just happen. Like most other orthopedic things, the initial treatment is typically conservative. So that would be rest and activity modification, sometimes immobilizing in a boot or cast for a short period of time. Oftentimes that can be successful, but if it does require surgery, that typically is addressed with an arthroscopy of the ankle and either a microfracture, which just means that we clean up the unstable cartilage and the unstable bone and then stimulate the underlying bone to bleed and form a patch of scar cartilage. Dr. Thompson and I have known each other for 20 years as we were both residents at Vanderbilt together and only separated by 1 year. Subsequent to our residency, we went different ways for a period of time. I've been here at Elite for 15 years, and then Dr. Thompson joined us about 5 years ago. We continue to bounce interesting cases off of one another on a regular basis, and occasionally we'll even do particularly challenging or interesting cases together. Thank you for joining me today. I hope you found this beneficial. Certainly if you want to find any additional information, feel free to look on our website, eliteorthopedic.com, or can always contact our office to set up an appointment to see me. Thank you.